Dr. Ara Deukmedjian, CEO and founder of the Deuk Spine Institute. It is August 4th, 2026. We're going to be streaming live spine surgery. Our patient comes from North Carolina. He's had 4 years of neck pain radiating into his shoulders, down into his arm. He has weakness, numbness, tingling in the left arm. We call that radiculopathy. He has 3 herniated discs. The worst one is C4-5, followed by C6-7 and C5-6. He also has facet joint pain on the right side, which is severe, but we're not treating that today. He elected not to treat the facet joint pain. We're only fixing the 3 herniated discs. Now, herniated discs are the #1 cause of neck pain, and they account for 90% of neck pain. Shot. We're going to use the X-ray machine here in the operating room, AP, in order to guide the surgery. Spine surgery is guided by X-rays. X-rays look at bones. We're going to use an AP X-ray. Jordan, show the audience the tip of the needle where it's centered right in the middle of the spine and heading off to the left through the disc. Show them the tear on the left side at C5-6. Nope, it's a little lower than that. Yep, right there. You see the tear and the dye leaking out, that black line? It's leaking out on both sides at C5-6 because there's tears on both sides. But it's worse on the left. And his symptoms are worse on the left. You can see the endotracheal tube because our patient is asleep. Kimmy, let's show the audience the 30 different causes of neck pain that we commonly see, 30 causes. And remember, discs are the #1 cause, and that's what we're fixing today in this patient. Facet joints are the #2 cause. He also has facet joint pain. We talked about fixing them, but he wants to hold off. Let's get the blood pressure down. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3. Next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk Laser Disc Repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Great job, Kimmy. We have here today on the broadcast for our live spine surgery, Kimmy and Anthony. Anthony is teaching Kimmy today. So if you have questions, feel free to type them up on YouTube or Facebook, and we will answer them for you live. Our patient, once again, is a gentleman who's got 3 herniated, degenerated discs in the neck, C4-5, C5-6, C6-7. He wants me to fix all 3 today. That's what we're doing. He's also got arthritis in the facet joints. He did not want to get that treated. So you can see from our video that the Disc is the #1 cause of neck pain, the disc, and it's a herniated disc or degenerated disc. That's the source. Now, in addition to neck pain, people also get arm symptoms or myelopathy. Arm symptoms like weakness, numbness, and tingling we call radiculopathy if it's due to a nerve being pinched, which he has, by the way. And if patients have spinal cord damage, we call it myelopathy. So, nerve damage, radiculopathy; spinal cord damage, myelopathy. Any questions? Feel free to type them up. Right now you can see the tip of the tube I'm placing through his C5-6 disc. Right there, Jordan's pointing with the white arrow. Do you see the white arrow on the x-ray, Kimmy?
Yes.
Is that what the audience is looking at?
Yes.
All right. I want you all to know this is the future of spine surgery happening right here today at Deuk Spine Institute. We've been performing endoscopic spine surgery for 20 years. And we've been doing the same surgery for 20 years. Look at this. This is the blood for the whole surgery. It's literally 2 or 3 drops of blood, less than a nosebleed. That's all we're going to have. That's because this surgery is relatively bloodless. Also, our patients go home the same day. Alternative treatments include anterior cervical discectomy and fusion, or anterior cervical discectomy with arthroplasty, aka artificial discs. But when you put artificial discs or metal plates and screws, you change the basically the biological function of the spine by fusing or inserting implants that are foreign. You increase the risk of complications such as spinal infection, hardware failure, loosening, fracture, adjacent segment disease, spinal fluid leak, nerve damage, difficulty swallowing, dysphagia, odynophagia, all kinds of other complications that happen with invasive spine surgery. With the Deuk Laser Disc Repair in 20 years, and now we've performed how many Deuk Laser Disc Repairs, Anthony?
2,790.
2,790 Deuk Laser Disc Repair surgeries. Now, Deuk Laser Disc Repair is our version of endoscopic spine surgery. Okay, the reason we perform this particular surgery is it has the best results. We could perform any type of spine surgery here at Deuk Spine Institute. We chose this surgery because of the results for the patient. Patient results are the most important thing in medicine. When doctors choose treatments, we should always put the patient's needs first. Bring the light down 2 clicks. You can see the bottom of the tube. There's the herniation right there. You can see the laser fiber. Why is this? I got it. Thank you, Jordan. Thanks, Sam. It's good. It was just sideways, the pedal. I have to adjust the focus. Give me a second. All right. The reason we do spine surgery at Deuk Spine the way we do it is because it has the best result for the patient. There are 4 things that patients care about. 1, getting rid of their symptoms, symptom relief. And that's called outcome data, patient-reported outcome data, symptom relief. The Deuk Laser Disc Repair has the highest success of getting rid of patient symptoms at 99.6%. That's data we've collected from our patients by looking at 5,000 patients that had this endoscopic procedure done. That's a herniation right there. We've been pulling herniations out. That's what they look like. These herniations are calcified and collagenized, meaning that they've under the influence of inflammation for many years, and that's what they look like. That's not what they look like when they happen right away. When they happen immediately, they look soft like a marshmallow, but these are hard calcified herniations, and we're still able to remove them with laser. That's one of the reasons we do the surgery, is the success at eliminating patient symptoms. The second most important thing for patients is safety. They want to know that if they're going to have a procedure, that they're safe. They're not going to have a complication. With invasive spine surgery like ACDF, artificial disc fusion, complications are very, very common. And patients end up a lot of times worse after surgery than they were before. Not with the Deuk Laser Disc Repair. Our laser surgery is the safest. In 20 years and 2,790 surgeries, we've never had a surgical complication. No infections, no nerve damage, no spinal fluid leak. Look at these herniations coming out. Remember, this is 5-6, C5-C6. There's a piece of herniation. So far, I've taken out probably 10 pieces of herniation or more, and they keep coming. Remember, if you have questions, feel free to ask us. In the meantime, let's show the audience why do patients' disc injuries cause so much pain and symptoms for them? What's the basis for that?
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. You could see from the animation, look at the size of this herniation that just came out. This is like literally the 12th piece that I've taken out. And this one's about 5 millimeters. Remember, each herniation by itself, did you see that, Kimmy? Did you switch to the camera in the sky and show the audience this piece of herniation I just pulled out?
Yes, sir.
One of 12 so far, just from C5-6. Remember, we still have to do C4-5 and C6-7. This is just C5-6. So far, we've taken out so many pieces of herniation. But things are starting to look better for the patient. Any questions from our audience?
Yes.
Sure.
This is from Colonial on YouTube. Doctor,
Colonial.
may I ask what you think of Elon wanting robots to take over your job?
Kimmy, I heard, what do you think about Elon? And then did you say robots taking over my job?
Yes.
Ah, okay. Well, great question. Thank you for asking. First of all, I do like Elon. The fact that he's a trillionaire or whatever he is doesn't bother me. I'm happy for him. I believe that people that work hard and have great ideas that benefit humanity should be rewarded. Okay, so I'm not bothered by Elon at all. However, I will warn you and everyone that a lot of inventions that you see out there today, especially today in the last 10, 15 years, beware. They're not as beneficial or valuable as you may be led to believe. For example, his brain chip. It just so happens that many of you know I'm a brain surgeon, and my research area was in computer-brain interface about almost 35 years ago. And there are problems with computer-brain interfaces, okay? So this Neuralink chip that Elon's developing is not going to work because of the fact that we've tried this so many times, and what happens is scar tissue develops around the electrode prongs that are embedded within the brain. And so there's a lot of hype about Neuralink, and I feel like investors and people are being misled, okay? Sure, the movies have cyborgs and robots with, half human, half computer, which is wonderful, right? Isaac Asimov, if you go back to the 50s and 60s, wrote about these cyborgs, which are wonderful, right? For humans to have augmentation. If you watched Ghost in the Shell, you can see this whole computer-human interface, right? That it benefits humans somehow. But the reality is, a lot of these companies just want to steal your money. They want to do an IPO, they want to take your money, and they want to get rich off of you, and then you end up holding the bag on an investment that has no future. Okay? Will computer-brain interfaces ever work? I'm sure eventually someday they will work. But the way the Neuralink is designed, in my opinion, and this is just my opinion, it's not going to work. So you didn't ask me about Neuralink, but I'm using this as an opportunity to talk about Neuralink. Okay? As far as robots taking over my job, what I specifically do here at Deuk Spine, it will not happen. Okay? And I'll tell you why. Inherent to AI and robots is a process called machine learning. And what machine learning means is that a human is training a system, a data system. It's basically inputting data points, reference points, into that data system. There's only one human on earth that can do what I'm doing, because I pioneered and created these treatments and I have patents on them. So the only way that Elon Musk's robots can do what I'm doing is if I train them and I license my technology to them. And that's not going to happen. Why? A lot of reasons why. But the main one is something called quality control. I'm not interested in profiting from people's misery. Okay? I've restrained myself all these years as a neurosurgeon, spine surgeon, scientist. I'm guided by principles of ethics. What that means is, if you're going to offer a medical treatment to a human being to improve their life, it should improve their life, their quality of life. You don't do it just for money and then find out later on that your treatments didn't work and it made them worse, which is most treatments these days, but we don't perform those treatments here at Deuk Spine. We believe that patients who have medical treatments should benefit from the treatments. All right, there should be an enduring benefit. Enduring just means that it lasts for a long time. So it's not just for an hour or two or for a few weeks, like many treatments for back and neck pain are these days. They're ephemeral, meaning they don't last long, they wear off. Our treatments at Deuk Spine are permanent. When I fix a disc like this, it's a permanent fix. The patient benefits from this surgery the rest of their life. Their symptoms don't come back unless, of course, they do something they're not supposed to do, like, go out and go fishing and they pull in a 500-pound tuna, okay, 2 weeks after surgery. I've had a patient do that, all right? He did it, and he told me afterwards when he re-herniated, he said, I knew I was going to re-herniate, but I had this 100-pound sea bass, and I wasn't going to let it go, okay? So I knew I'd be coming back having a second surgery. Our patients at Deuk Spine that receive this surgery, we have a 99.6% cure rate, and we have a re-herniation rate of 1%. That means 1 out of every 100 patients will come back with a re-herniation right where I did my surgery, and they will need a second surgery. That's a fact. Okay, we're guided by facts and numbers, and that's a fact. But every single time they had to do that, it's always because they ignored our restrictions. And you need to have restrictions after this kind of surgery for about a year. You got to avoid contact sports like football, rugby. All right? You got to let the disc heal properly. Once it's healed, then you can go and do whatever you want. But until it's healed, you have to be careful and not do too much. Okay? So, getting back to your question, will Elon's robots, or anybody's robots for that matter, do put me out of a job. Maybe. I'll give it a 1% chance in the next 30 years. But I'm not going to say it's zero, but there's a small chance. And just so you understand what I do here, what you guys are seeing is seeing. It's visual, right? You guys are watching me operate. But what you don't know is everything that goes on behind the scenes to make this stuff happen properly. And you don't know what I'm feeling with my hands. Okay? Yeah. So what I'm getting at, I'll answer Dr. Berndes' question in a moment. But what I'm getting at is surgery is more than just visual. It's tactile, all right? And right now, with these robot-assisted surgeries, like with the Da Vinci, the robots are learning how to do these surgeries because they're taking the inputs from the surgeon doing the surgery and they're remembering them. Does that make sense? So these robots give surgeons like resistance or tactile feedback. Basically, they can give you counter resistance so you can feel resistance to your tools, right? Without resistance, you can't really operate. And that's why the earlier robots would cause problems for patients. They would literally perforate perforate their organs because the surgeon had no real depth perception and no sensory feedback. You must have sensory feedback to do surgery, okay? You got to feel the resistance. So yes, it's possible today using robots for certain types of surgery where those robots have been trained by surgeons, but there is no training happening right now with my procedure. And I have no intention of training a robot anytime soon. Okay? Could it happen in the future? Sure. I'd have to be convinced, though, that the quality of the surgical outcome is going to be equal to mine or better. Does that make sense? So right now I'm at 100% symptom cure rate. 99.6 rounds up to 100. I'm at 0 complications from the surgery. And I'm at a 1-hour recovery for spine surgery, which is unheard of in the world of spine surgery. So how could anyone do better than that? Even a robot? I've never seen it. Could it happen? Sure. I think it could with my help. But Elon hasn't been knocking on my door. Remember, Elon, the richest man in the world, went and had spinal fusion done. Why would Elon get a spinal fusion? Then he had another surgery, artificial disc. Elon Musk has had more than 2 surgeries on his spine and his neck. So how could his robots be better than his own judgment? His own judgment is flawed. He should have come to Deuk Spine. We were performing this surgery when Elon Musk had his surgery. It just goes to show you that your results will only be as good as the data you have. So Elon didn't have the right data, and he went and had neck surgery done by some surgeon who botched his surgery. He ended up having a fusion. He had another surgery and then a fusion. So Elon's had how many neck surgeries? My patients have 1 surgery. Okay, that's it. I fixed their problem. They don't have to come back and get another surgery. So if the owner of Elon's robots, Elon Musk himself, can't even make the right decision about spine surgery, how do you expect his robots to make the right decisions? You understand what I'm saying? Humans are still better, and for the foreseeable future, when it comes to anterior cervical endoscopic surgery, I think humans will stay better. All right, we're going to move out of C5-6. You guys see that? Show them, Jordan. Count. Let's take another shot. Okay, 2. Show us 2. C2, C3, C4, C5, C6. So we are at C5-6 disc space. We're at the back. I've just finished removing the herniation, and we're going to try to move to 6-7 down below. To do that, it's going to take almost an act of God because he's got a very thick neck and he's very muscular. Are you going to give him another slug of muscle relaxer? Yeah. Let's give him one more slug because this is not going to be easy, and I want all the help I can get moving our tube down to the next level down. So to start, hey, hold on. I'm going to remove my tube out of the disc space, leaving the dilator shot. Okay, you can see the tube is now out, shot. Dilator is in. Okay, got to be careful with the tip of the dilator. There's no way a robot is going to be able to do what I'm doing right now for at least another 50 years. Okay, this is the hardest part of the surgery, and it takes a human brain and human hands to do this. I'm not discrediting AI or AGI, whatever you want to call it, which is the future of AI, general AI, but it's going to be a long time before they can do what I'm doing. You guys ready? All right, that's good, Jordan, that's good. I'm going to come out of C5-6, and I'm going to slide south, and notice that this takes every bit of concentration. Shot. And I'm about to pop out of the disc and slide down the front of the spine. Are we relaxed?
Yes.
Good. All right. I'm sitting on the front of the spine. I can feel it. I don't know about you, but I wouldn't want a robot doing this right now. I wouldn't trust a neurosurgeon to do this. I'm the only person in the world that can do it. All right, let's go back to a lateral view. So I'm a little bit off to the right. I need to move a little bit to the right. All right, which I just did. And I just got to move south a little bit. All right, let's see if we can do this safely. I don't know that I can get down there, but I'm going to try my best. Shot. All right, looks like we're just about there. Shot. Yeah. All right, AP. We're sitting in the front of the disc at C6-7. This is the hardest part of the surgery. There's no robot in the world that can do this right now. This requires not just a neurosurgeon, but one of the most skilled in the world to be able to make these moves right here and coordinate with the anesthesiologist and the entire team. I moved north a smidge. I want to move down a millimeter. All right, shot. I just moved down a millimeter. I'm going to anchor, shot. I'm anchored. I'm going to go in, shot. Yeah, this, what you're watching right now, is not doable by a robot. But thank you for asking. I think it's a great question. I love the question, actually. Shot. Shot. Besides, by the time a robot can do this surgery, shot, there won't be any humans. It'll just be robots operating on robots. I hope you take that comment seriously. We all need to be very aware. The humans will soon be the weaker species. And we all know what happens in this world, in this universe. Yeah. Darwin has already worked out the details. Just read the book, Origin of Species, by Charles Darwin. And you'll understand where we're headed. Because Darwin has already created the roadmap. I'm sorry if you don't like what I say, but I'm not here to say what you want me to say. I'm here to say the truth. The truth is, humans are about to be made extinct by our own creation. And isn't that how it always is? You realize that. If you study natural evolution, you'll understand that parents create offspring. Offspring are either better, equal, or worse than the parents at adapting to their environment. If they're better, they go on to make more offspring themselves, and their offspring end up having physical and behavioral traits that are better than their parents for adapting to their environment and surviving. Okay? On the other hand, those offspring that have physical and behavioral traits that are worse at adapting to the environment, wait, not yet, are going to die. Now, we've just created AI and robots. We humans, they're our offspring, figuratively speaking. And they are better adapted to this world than we are. So who do you think will become extinct? Any other questions, Kimmy?
Yes. This is from Colonial on YouTube. Where did Dr. Deuk study?
Well, Kimmy, where did I study? I've studied in many places. It's a great question. Smart person for asking. I would refer you to my biography on our website. Look at it, please. Kimmy, put a link, maybe Anthony can help you, to my page, my biography page. And Anthony, maybe put a link to one of my blogs on the website where it talks about my education. But basically, to summarize, I began my life in Germany on a United States Army base. My father was in the Army. He was drafted in the Vietnam War. I need the camera on. And he served overseas. He was stationed in Germany, which is where I was born, along with my sister. I came back to the United States and grew up in Southern California, in a place called Thousand Oaks, California. That's where I spent my childhood years and my high school years. It wasn't until I went to college that I left Thousand Oaks and ended up at UC San Diego, University of California, San Diego, one of the top universities in the world and one of the best in the UC system, known for biomedical sciences and engineering. I left UC San Diego after graduating, and I went to medical school at USC in Los Angeles, University of Southern California. Top med school in the country, one of the top 20, and received my medical education at USC, where I graduated valedictorian, top of my class, number 1. Then I went to neurosurgery residency in Florida. Why Florida, you ask? Because Florida had the best training program in the world for neurosurgery. All right, I may have an issue here. Trying to think through this. So what you're seeing, folks, is bleeding from basically bad arthritis that's going on inside this disc. Okay? I think we need a new fiber. Laser off, light on. You see compromise? Anything black? Huh? I don't see any crack in the outer membrane. All right, let's go ahead and put this back. Oh, I see what's happening. The irrigation tube is kinking again. We have this problem over and over again, Luis. It's become a repetitive issue. All right, we're just reassembling the rig. Stand by on that fiber. Stand by. Do not open it. All right. After USC Med School, I did residency at University of Florida in the top neurosurgery training program in the world at the time. It's no longer, but it used to be. That was when Dr. Roten was the chairman, Dr. Albert Roten, very famous neurosurgeon. I had faculty including Dr. Day and Dr. Friedman, Dr. Mickel, Dr. Fessler, all world-renowned neurosurgeons in their respective fields. Then I graduated and had the choice. Well, during my residency, I did NIH funded research, National Institute of Health, as a principal investigator. Let's see here. And my research at the time was in computer brain interface type stuff, functional neurosurgery, epilepsy. I studied how the abnormal brain development called cortical dysplasia resulted in seizure activity. All right. Nope. So I spent, lights on please.
Two on, please.
Come on, Sam, pay attention. No. Trying to figure out if it's a problem with the adapter. Yeah, it's sliding.
Can I have walking seat, please? Thank you.
All right, let's go back in.
Two off, please.
And then after University of Florida, I ended up in private practice here in Florida, where I've been ever since I graduated my residency. So I haven't left. Are you inspecting these tubes? All right. Well, 6-7 has been very difficult for us. You think another fluid adapter would be better, Luis?
We can try that.
Mm-hmm. We're going to try another fluid adapter. No. How is he in terms of relaxation?
I think that it's you know,
Huh? He's not relaxed?
I think this is the problem is
Yeah. Mm-hmm. Now let me have the dilator. A new one is not going to help us, Luis. Mallet. No. We're just working through an issue. His disc is so collapsed and scarred down that it's crimped down on our tube and put so much pressure on the tube that I can't move the tube. So I'm having to try some new strategy here and see if we can't make this work. All right. Any other questions?
Yes.
It's more bony, yeah.
This is from Colonial on YouTube.
Uh-huh.
He says, "May I ask what part of Germany you were birthed?"
I was born in Bremerhaven, Germany. All right. May have to, Berndes, may have to give one more dose of that muscle relaxer. Not yet. I'll tell you when. All right. We're done here. We're going to move on to the last disc. I don't want you to give the dose yet. I'll tell you when. Any other questions?
No.
Which tube is this?
Huh?
Which tube is this?
This one is probably original ones.
I don't want you. You hear me?
Huh?
All right, let's show the audience, since we've already shown them the 30 causes of neck pain, and we showed them how the herniated disc causes neck pain through inflammation happening in the back of the disc where there's a tear and a herniation causing inflammation. Let's show the audience how we use laser to endoscopically clean the tear and get rid of the inflammation causing the neck pain, headaches, and pain radiating into the arm and shoulders.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4 mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debreeds the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, we're just in the process of removing the tube out of the disc at C6-7 and had some shot anatomical challenges, what I call them, shot anatomical challenges. What I mean by that, this patient is a very, very difficult surgery for many reasons. One of them, the discs are severely collapsed because he's had these problems for many years, which, you know, we can work through that issue. But he's also got a very big, thick neck, short neck, high collarbone, big shoulders, makes it very difficult. So on a scale of 1 to 10, his surgery is literally a level 12. Okay? Joking, but it is a very, very, very difficult surgery. Okay, let's get an AP view. We're moving our way up to C4-5. We finished 5-6, 6-7. We're heading up to C4-5. There's 2, 3, 4, 5, 6. I'm sitting in the front of C6. Shot. I'm going to move up. I'm dead center, which is exactly where I want to be with the tip of my dilator. I'm going to keep moving north towards his head. I have to get all the way up. Shot. Up to the disc above this next disc. Shot. All right, so I'm at the 5-6. I'm going to go above. I just went above. Again, these are things robots can't do today. Maybe someday they will, but it'll be 50 years. Like I said, by the time 50 years rolls around, humans will be extinct. Tongue in cheek, of course, I'm joking with you guys, but there is an element of truth. Shot? All right, what's our other question? Shot?
No questions.
All right. We showed how disc injuries cause neck pain and shot. Now I need to go north. Shot. All right, just overshot it. Shot. AP. Okay, I'm sitting in front of C4-5 now. That's the next disc. I need to check my AP view front back to make sure I'm in the middle, but on the lateral view it looks really good. All right, I'm way off to his right side, so I got to make myself go back to the middle. This is the hard part. Shot. I'm back in the middle. AP, I'm sorry, lateral. So I'm back in the middle, but I need to check my lateral view. That's perfect. I'm sitting right in the front of the disc at C4-5. I want to get it in before I slip out. I'm going to check the AP one more time. You always need to check and recheck and check and recheck. That's how this surgery is. Okay? It's double checking and triple checking. All right. Sean? Sean? Perfect. I'm going to clean out the center of this pipe, and then we're going to get a discogram. Sean? 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 Got a little schmutz in there, Luis. You're going to need to clean it out. Sean? Sean? No. So what's happened is because the dilator tip has a hole in the front for the guide wire to go through, that has filled up with a little bit of disc material and is not letting the guide wire go through, which I need in order to be able to do the discogram. Hold that, do one more time, guide wire. Any other questions from our audience?
Yes, this is from Colonial on YouTube.
Colonial, you're on fire today. Yes.
He asks, are there any rad techs on the team?
Yeah, we have Rad Tech here. Jordan. Jordan is Rad Tech extraordinaire. Yeah. Shot? Is that it? I just can't get it to go through. So it's too jammed up. We're just going to have to forego the discogram for now. We also have Monica, who's a Rad Tech. She's not currently in here. All right, there's a large herniation here at C4-5. So that's what I'm after, is that big herniation. And it's hitting on his nerves, causing radiculopathy. A C5 radiculopathy. Go ahead. All right. Shot. Show the audience where the tip of the dilator is and show them where the tube is, the tip of the tube. You guys see the tip of the tube in front of the spine? I've got to move the tube down carefully through the disc, millimeter at a time, monitoring the tip of the dilator. Of the 3 discs that we're fixing today in his neck, C4-5 is the least degenerated. 5-6, 6-7 are the most degenerated, with 6-7 being the absolute most. All right, we're halfway there. And see, I'm slowly moving this tube to the back of the disc where the herniation is. That's perfect. One more advance. We should be in great position now. Okay? And there it is, folks. Is that the new tube?
Yes, sir.
So the entire surgery is being done through this tiny little tube. This is a 4 millimeter wide tube. If you go to any other surgeon that does spine surgery, they're going to slice your neck open with a 3-inch incision. And afterwards, you won't be able to swallow. You'll have hoarseness. You'll be in the hospital, difficulty eating food or drinking water, coughing and choking on yourself, at risk for aspiration pneumonia and all kinds of other complications. But with our procedure, patients are out at a restaurant the same day having dinner. Okay, we've got a little bit of water or irrigation here on the lens that is giving me a little bubble. So let's fix it. There it is right there. Nope, it's there. See it? Yep. I think we got it. All right. Our patients go home in an hour after their surgery. An hour after surgery. Many of them travel from other countries, other states. This patient traveled here. I don't know, Luis. I don't know if you got it. It looked like we got it.
Thank you.
Let's get a dry Raytech, wipe that lens. And that's good. Wipe this lens really good. It could be, I see something there. You see it? It may actually be inside the lens. You see that? There's something right there, but I don't know. Let's see. We may have to have the scope looked at. Okay, I'll show you where it is. You can actually see it on the camera. All right, see it to the right at 2 o'clock or 3 o'clock? You see it? Yeah. I think it's not water, but it's actually a problem with the lens itself. So we're going to have this checked out. Shouldn't interfere with my ability to do the surgery, but we need to have it fixed. I have a feeling there was an arc from the laser itself. But hopefully it's easy to repair. Any other questions?
No.
We've got 10 minutes left on this surgery, so if you have questions, feel free to type it up. Let's show the audience, in that case, we've talked about the 30 different causes of chronic neck pain, with the disc being number 1. Let's show the audience how the Deuk Laser Disc Repair procedure we're doing right now compares to other types of spine surgery that people have available, such as fusion or artificial discs. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. I'm here to talk to you today about neck pain and its common treatments. Neck pain has different causes. The most common cause of neck pain is a herniated disc. Herniated discs account for about 85% of chronic neck pain. The second most common cause of neck pain that's chronic is the facet joints. There are facet joints on both sides of the spine, left and right. There is one facet joint for every disc. Facet joint pain requires a different kind of treatment targeted at the facet joint itself. For disc pain, which accounts for 85% of neck pain, the best treatment in the world is the Deuk Laser Disc Repair. It is the most advanced treatment that is the safest and has the highest chance of successfully eliminating symptoms. Let's talk for a moment about what's important for patients who are considering treatment for neck pain coming from an injured or damaged disc in their spine. The most important thing for patients, number 1, is getting rid of their symptoms. The type of symptoms that disc herniations or disc injuries can cause include neck pain, headaches, and symptoms down the arm, such as weakness, numbness, tingling, or even pain shooting from the neck down into the arm. The symptoms of neck pain include disc herniations, which are the most common cause, and patients want those symptoms gone. That is their number 1 priority and goal. The second most important goal for most patients is to avoid a complication from the treatment. Medical treatments do have complications, and the more invasive the treatment, the more likely a complication will occur. Complications from surgery, for example, can include blood clots, pneumonia, heart attack, infection, failure of the spine to heal properly after surgery. There can be implant migration or implant failure, adjacent segment disease, and vascular complications such as injury to the blood vessels or nerves in the neck, including the trachea and esophagus. Nobody wants a complication from spine surgery on their neck, so less invasive is typically going to be a better option to avoid those complications. The third thing patients really want when they're looking at treatment options for curing their neck pain is they want a quick recovery. People want to get back to a normal life as quickly as possible. They want to go back to their activities, they want to be active, they want to play sports, and they want to go back to work. And finally, the next thing to consider is long-term results. For example, if you have a treatment today and it works, how long will that treatment last, and will it create additional problems down the road for you? Treatments like spinal fusion that are invasive typically result in the need for additional treatment such as pain management, physical therapy, and possibly additional surgery. We're going to look at each of these individually and go through each of these options individually. So we're going to start with more invasive treatments that are typically recommended for patients with herniated discs or degenerated discs in their neck. The most common treatment recommended around the world is anterior cervical discectomy and fusion. That is a surgical treatment where the entire disc is removed surgically through a large incision, that is very risky. There's bleeding associated and risk of injury to surrounding structures such as the esophagus, trachea, and blood vessels in your neck. Complications are very common with this type of surgery. The complication rate is accepted at 48%, which is a very high number. So if you're considering ACDF or anterior cervical decompression and fusion, you are looking at a very high complication rate. The success rate of this surgery at eliminating neck pain is very low. It's somewhere on the order of 25%. That is the generally accepted success rate at eliminating neck pain. An additional treatment that you can consider is artificial discs. Artificial discs are very similar to ACDF. The difference is instead of fusing two bones together with a metal plate and a cage, we're actually putting in a mobile disc made out of metal and plastic that moves. The problem with the movement is that these discs do pop out of the disc space. Over time, they can fail. They can cause collapse of the vertebral body above and below through fracturing, especially in patients with weak bones, such as osteopenia or osteoporosis. Those types of patients are at high risk for complications from both ACDF and artificial discs. Another complication from artificial discs is that you can develop facet joint pain and adjacent segment disease, very common with artificial discs and fusion, and they typically have the same rate of adjacent segment disease. There's also a long recovery associated with both ACDF and artificial discs. Recovery can take months to years, if recovery even happens at all. There's tremendous scarring in the wound associated with ACDF and artificial discs. Lots of scar tissue, lots of pain, and lots of problems after these surgeries that are invasive. Alternative treatment would be to go in the back of the neck and do a cervical laminectomy and fusion. Again, large incision, high chance of complications, very long recovery, taking years to recover. All three of these types of surgeries, ACDF, artificial discs, and posterior cervical laminectomy and fusion, require the use of postoperative narcotic painkillers. Narcotic painkillers are opioids. They are dangerous. People get addicted to them, they can be abused, and people can overdose. It's easy to overdose on narcotics because you want to keep taking them to treat the severe pain you're going to have after these invasive type surgeries. The severe pain can last weeks or even months, and the addiction can happen very quickly. Let's move into less invasive treatments such as epidural steroid injections. This is a treatment commonly recommended by pain management doctors. They stick a needle into your spine and inject the steroid medicine to reduce inflammation. While this treatment can be effective at temporarily giving you relief for a few days or even a few weeks, the pain always comes back from a herniated disc because the source of pain is never being treated. The annular tear and inflammation within the annular tear is not treated by an epidural steroid injection. The steroid goes throughout your body and causes systemic side effects such as high blood pressure, elevated blood sugar. In patients with diabetes, this could put your sugar up into 300s and 400s, which is very dangerous for patients. So steroids should be avoided as much as possible. Next, let's turn to spinal cord stimulators. The problem with spinal cord stimulators is they are highly invasive and they are frequently put into patients by untrained doctors who are not surgeons. These doctors are typically pain management specialists, and they're putting these stimulators in patients not because they can cure your pain, but because it's another treatment that they have up their sleeves. These treatments with stimulators pay these doctors obscene amounts of money. The profit for the doctor can be in the tens of thousands of dollars. Avoid spinal cord stimulators. They do not work, they're dangerous, they put you at tremendous risk, and in the end, basically you're taking this device, sticking it on top of your spinal cord and putting a pacemaker under your skin that you're gonna have to live with for the rest of your life. They cause scar tissue and they frequently migrate and get out of position. Next, we're going to talk about physical therapy. While physical therapy has many benefits, such as keeping you toned and fit while you're struggling through the pain and trying to stay mobile, but physical therapy will never, ever cure pain in the neck from a herniated disc. It will just try to keep you active and from getting more and more sedentary and developing deconditioning of your muscles because you're sitting around because you have neck pain all the time. Finally, let's talk about the Deuk Laser Disc Repair. The Deuk Laser Disc Repair is the solution for neck pain. If you have a herniated, bulging disc, extruded, ruptured disc, protruded disc, or degenerated disc, the Deuk Laser Disc Repair works by minimally invasive treatment, going to the back of the disc where the problem is coming from. This is the tear in the back of the disc that has inflammation, and using a laser that is extremely precise. The laser fiber itself is 0.5 millimeter or half a millimeter wide, and the endoscope allows me to see 1/20th of a millimeter. I can directly see the nerves and spinal cord. It is an extremely safe treatment. As far as results go, the Deuk Laser Disc Repair has the highest success rate of all the treatments we've discussed so far. We have a 99% cure rate of neck pain coming from herniated discs, and the Deuk Laser Disc Repair has 0 surgical complications to date. Our patients have an immediate recovery. In 1 hour, they're leaving our facility and they're going back to their hotel room. They usually drive themselves in the next morning for a quick checkup, and then it's back to a normal life. Well, I've enjoyed talking to you, and thanks for taking the time to listen to our video. I'm Dr. Ara Deukmedjian. We'll also find this on our podcast at Deuk Spine Institute Podcast. Thank you. Yeah. Why are there laws against children working? Why are there child labor laws? Because children aren't intellectually capable of making the right choices, right? That's why we require adults to do it. All right. Welcome back. You can see from our video why this surgery you're watching right now. By the way, we've been removing pieces of herniation. Every time I get a piece of herniation into my tube, I float it out. You guys see that? So there's the laser removing pieces of herniation from the back of this disc at C4-5. And of course, once I remove the herniation, I literally come out with the scope, and the hydrostatic pressure or water pressure from the irrigation pushes the pieces of herniation up and out of the tube. But this is a pretty bad herniation here, C4-5. In my opinion, this is accounting for a large part of his symptoms. We also saw a good size herniation at C5-6, okay? This is the back of the disc. That's your tear in the annulus fibrosus right there. You guys see all that herniation down there? And that's the foramen, the neuroforamen. And those pieces of herniation are literally, we're releasing them out of the foramen and floating them out of the shaft. The shaft is that metal tube I showed you guys earlier. It's 4 millimeters in diameter, okay? And to give you some perspective, Berndes, I got 3 minutes left, maybe 5 at most. To give you perspective, that laser fiber there you're looking at 12 o'clock is half a millimeter wide. So half a millimeter, 0.5 millimeter. That's how tiny this is. Our procedures are extremely precise. Unlike other surgeons that do fusions, they're showing you afterwards the big metal plate in your neck or the metal artificial disc they put in. Those are big. And that's why people hurt so bad after surgery, because there's so much damage done to normal structures in your neck by the surgeons. They're cutting your muscle, they're cutting your ligament, they're cutting your normal bone. So when you start cutting normal things out of your body, it does a couple of things. One, it creates instability. So those surgeries make instability, which is why people end up coming back after their fusion and having to have another fusion or having to have a second level treated. So surgeons are now treating 3 and 4 levels at a time. Stay away from spinal fusion. You don't need it done. This is a far better surgery for you. That's why this patient traveled from North Carolina to Deuk Spine to have his procedure done. And he's got a bad herniation here. I can see it. But we're almost done. We've already fixed 2 others. This is probably the worst one, number 4-5. Look at all these pieces of herniation coming out. Any questions?
No questions.
All right. What was that? Let's try to keep those kind of things to a minimum. All right, guys, we got about a minute or two left and we're done. So far, his surgery is going great. How is he doing from an anesthesia standpoint?
He's doing great. Good blood pressure, vital signs.
All right. I would like to take the moment to congratulate my team here. We just received our inspection from the state inspector, and they said things like, this is the best surgery center we've ever seen. It's the cleanest, nicest, most compliant with all the rules and regulations. We checked all the boxes, and honestly had the highest score I've ever seen on a survey from AAHC. So I've been having surveys now done for, well, 14 years, and I've never seen my center perform so well under the direction of Dr. Berndes, Hector, Jordan, Luis, Sam. Who else? Who am I missing? Monica. You guys have done an amazing job. So, got a great team here. Very lucky to have them. All right. We are just about done. I'm heading back to check out the other side. Every time I look back, I find another little piece of herniation. But we're just almost finished here. Keep that line open, Luis, that irrigation line. You guys can see the posterior longitudinal ligament down there running left to right with its fibers. You guys see it right there? That's herniation, but then those white fibers are the PLL. Any other questions? Because we're just about done in 30 seconds.
No questions.
All right. Great. In that case, thanks everybody. Last few zaps. Last chance to get your question in. And we'll be done. We'll be back later with a patient who has lower back pain, L5-S1, herniation, and is here for us to basically fix his back pain by treating his herniated disc. Oh, there's a nice piece of herniation just came out. You guys see that? Found a little repository. Just about done. Why, is he going to wake up as soon as you turn that machine off? I'll be impressed. Never seen it, but I'll be impressed. Yeah, I just found a little bit more herniation, and I want to get these guys out too. Try to be as thorough as we can, but we don't want to gild the lily. Right, Berndes? No lily gilding. How much irrigation is left? Perfect. I think that should be it. I just unveiled a little nest of herniations there, which, wow. Yeah. See that, Berndes? A little bit unexpected. Any questions?
No questions.
All right. How close is he? Huh? All right. Very good. I was very happy with that. No, just need to. Any last minute comments or questions? We are done. I'm taking his tube out. We lost probably 1 cc of blood, which is 20 drops. He's going to go home in an hour. But we're finished. Look at that. Tiny little cut, about 5 millimeters. Nothing. A little nothing. Fix 3 discs. I'll hold it. All right. Well, let's leave our audience, if there's no more questions, with a video of one of our patients who had this done in the past. And good morning, I'm Dr. Deukmedjian at the Deuk Spine Institute. I'm here with my patient who traveled to Deuk Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4 millimeters. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then?
Yeah.
Why did you decide to come to Deuk Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
And fusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary, because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck, and it was really bad. I would turn my head anyway, and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research, trying to look for exercises I could do to help my disc, he popped up on my feed and said, "Do you have a herniated disc? I can fix you." And the more research I did, I was just so thrilled, because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it, and I was like, "You're done already?" The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Deuk Laser Disc Repair and the Deuk Plasma Rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here.